I put it on my WhatsApp for the Black Nurses and the Palm Beach County Black Nurses Association, and also Palm Beach County Black Nurse Practitioners. And so they do have some donations that I'll be picking up. And then I also gave them the web information that you gave me last night.
Perfect. Oh, thank you.
Mm-hmm.
That definitely will help. Yes. Oh, hi, Miss Christine.
Hello. Good morning.
How are you?
Good. How are you?
I'm good. I'm good. I'm glad you can make it. Yeah.
Well, gardening.
It is, but I think people, once they got the tickets, they were asking me a lot of questions. I said, okay, so I think it would be easier just if we sit together and then get all this information out, and then so we can work together. For some people were worried about, okay, maybe I've not done what I'm supposed to do, but no, there's specific things that we need to do like each month to make sure we are ready, all of us. So, in respect of time and people who are here, I think we should start. This is a good showing at least. And then we can record and people will be able to see this. But hi, Frank. So good morning and welcome to the May general meeting. So this is going to focus on you got your ticket, now what? So we have a few things that we need to just be aware of, what organization-wise, things that are happening behind the scene. And then we're going to focus on specifically what we need to do from the few days left for May, and then June and July, so we can be ready to go in September. To start with, I want to thank everybody for being here, also buying your tickets and dedicating your time, money, and resource and expertise to go and help the vulnerable population in Tanzania. So on their behalf, thank you very much. On the behalf of the organization, thank you very much for trusting us to spend time with you. To start, as I said, always, we're so blessed that people think and value helping others or paying forward. We're going to start with a prayer, and I ask our prayer warrior, one of our global volunteers, yay, to give us a little blessing and thank God for the opportunity and the ability for all of us to go and do the work and come safely and come back safely to join us, our family. So, Mr. Steve Jones, take it away, please.
Yeah, good morning, everyone. Can everybody hear me now? I hope all is well. Everybody enjoying this holiday weekend eventually. Those who are joining the trip to Tanzania, I'm telling you, it's going to be an exciting event. And you, for your first time, you're going to really enjoy it. But we're going to pray. Father God, in the name of Jesus Christ, as we come before you today, oh God, we come thanking you for your glory and your grace. Thank you, God, for just fresh air to breathe, clothes on our back, oh God, money in the bank, car to drive, just the simple things in life, oh God, we thank you for right now. And you have provided that, oh God, to us, and we thank you for it. Now, God, we ask you to bless this particular meeting that we're going in to be involved in, oh God, that our minds and our hearts come together and congeal and to be at one, oh God, to help your people that are in need, oh God. You sent your son, Jesus Christ, down to help us, oh God. Now let us do the same thing and go and help those people, oh God, in Tanzania who need our help in the medical mission, oh God. We just want to thank you right now for your glory and your grace. And God, bless each and every one for a safe travel there and a safe travel back, God. Bind every enemy and every demonic spirit, oh God, that come against this particular program right now. We catch you out of our mind. We catch you out of our thoughts. God, we catch you out of this mission. Let this mission be safe. Let it be helpful. Let it be secure, oh God. And let us be able to go over and do what you want us to do, oh God, and to help those people that are in need. This we ask in Jesus' name we pray. Amen.
Amen. Thank you. Thank you very much. Okay, whew, I feel the blessing. Okay, so as I said, we have so many things going behind the scene, and bear with me, guys, when I keep posting on in the group chat, because I do want you guys to know what is going on. I know sometimes it's too much, but sometimes I get messages on the side, people are asking me, so I share those questions in a group, because sometimes maybe you're thinking of it and you don't want to send me a message, or you're busy or something like that. So bear with me, because we want to make sure you are informed. And if you have any question, please don't hesitate to ask, because I won't be able to explain it if I don't know if you're asking that question. And sometimes maybe we need to redirect something, so just let me know so we know for sure to address your concern. And I thank you again, and I will continue thanking you for valuing the other people's life, and you taking your time to go with us to go and help the people in Tanzania. So thank you, and thank you, and thank you. So to start with, anybody has a burning questions before I can go over things that I prepare for you guys? Anybody? Going once? Going twice?
I do.
Yes, please go.
Did you find out about the pickup for
Yes,
the shipping? Oh, good.
yes, I'm gonna go over it, yes.
Okay. All right. That was it.
Perfect, thank you very much. Okay, so I am gonna share my screen. Okay, so thank you, Mr. Steve Jones, for the prayers and the blessing. So we're gonna do a little review. I'm gonna give you the rundown that meetings that we're doing, training right now to prepare for the medical mission, because we wanna make sure the nurses and doctors are trained before we get there. So when we get there in acute areas, then we'll be able to do more hands-on training. We're gonna go over the grant, with the ones that we applied. And the reason I'm sharing this information is like, if you know anybody who can help us, either the medical mission or the organization, or help you with some expenses, or they wanna be part of it to become corporate sponsor, this is an opportunity. Let me know so that we can work on the side and be able to make that happen. We do still have collecting donations, either social media, in-kind donation like supplies and stuff, and some people send it through the Cash App or Facebook. We can discuss that. Community outreach, some people are taking their time and introduce QHSC in their community, and then so that helps give us exposure, and that's how we get more recruitment and get more donations. We're going to discuss more branding and warehouse where we need to store our stuff, because when we're doing grants and they're asking for these corporate donations, they ask you what are they going to get out of it. So we're going to discuss that just briefly to give you an idea. Also, if you have an idea so you can help us, just please reach out to me. And then of course, I know everybody who is here and people who are going to be watching this video are interested in update for the medical mission. Okay, I got my ticket, and then what? So we're going to go through the list and your checklist, and I have homework for you guys. And after that, we'll be done. Okay, so to start with, quickly, we've discussed, we want to make sure whatever we are doing today, it can be applicable 5 years, 10 years from now, meaning like we can sustain our training. So we have to plant the seeds that will help us to get there. So meaning we have to start teaching, giving theory, the nurses and the doctors, healthcare workers before we get there. So 2 lessons, 2 sessions have been done already. One was for 5/19, another one was done 2 days ago, the 26th. One of the topic was the neonatal health, neonatal resuscitation. Our very own Dr. Lilian Msambichaka and Dr. Zaveri Banera, they did a presentation, and we have about 20 people attended, healthcare worker from Tanzania attended. And then we have another training, which was on the 26th, neonatal temperature and glucose changes. Our very own Dr. Fabian Guido and Dr. Martha Mkonyi from Tanzania presented, and we have about 40 people. So I think you can see the number is coming up because of the word of mouth, and we're introducing and posting and everywhere else. So the same thing I'm going to ask you when we post these videos, share with anybody else you don't know who may need that education or who may need, want to know or learn from that part, and then they can help us. More things to come. There's more ventilation, newborn ventilation. We have people who are going to be presenting. Dr. Fabian again, Ms. Emily Rosenberg, and we have another person from Tanzania. They're just waiting for them to confirm the time. We have postpartum hemorrhage, so that group we're still gonna start meeting regularly to get our content together and be able to share. We have our very own Dr. Gwen Randall, who is an CRNA, so with anesthesia part of it. And then we have the nurses, we have Professor Brown, We have Ms. Neema Mush from Buguni, and Mr. Jafari from Muhimbili, and Mrs. Sophie from here, US. So we're gonna work on it to try and get that content out because they do need those education. Some of the things that they ask is fetal monitoring, so screening of diabetes, neonatal hypoglycemic, and obstetric emergencies. So we're gonna post those dates probably for the next meeting, so that by then we have more dates secured and training continues. If you're interested in doing those training, just let me know. We can put you in the group and then be able to work with a group of people, teach them while you are here, and then we get there, can you continue teaching them at the hospital. Grant, this is just a little bit, as I said, some of the QHSC friends and members have been working tirelessly back behind the scene, and they've been asking friends and families and corporations to try and help us. So we have done a couple of grants, and if you know about grants, you can apply 10, 5, I mean, almost 500, and then you might get one. So we are looking for that one first to start with. So as many people apply and help us to apply, that will increase our chances for us to get it. So anybody who knows somebody for the grant, it doesn't matter how much it is, even if it's $500 or up to $100,000 or even $1 million, we welcome your ideas. Please come and help us. People are working tirelessly. Maricela has helped with the Staple grant. Valentine has helped with the Chick-fil-A grant. Miss Christine Behuniak and Miss Teresa Cooper are working on the nutritional project. We have had some success in that group, and we will receive a lot of donation of Cliff Bars. Our babies or kids at Nazini are gonna be blessed with all those Cliff Bars. So we got like 2,000 of them. So we're excited, and thank you, Miss Christine and Miss Teresa Cooper, for that effort. And we're gonna continue working with that nutritional projects to feed those kids for a whole year. With God's our witness, we're gonna do that. School supplies, Miss Janet Musa has been working tirelessly on that group, and the backpack has been ordered. So she has been raising, from her group, she's been raising money up to 2,500 now, and we are still working on it. But the total cost of all the backpack is 4,411. So we're still working on it, but the backpack has been ordered because we need to get them shipped by next week. So we're still working on it. So anybody who is willing to help support that cause or initiative, please do. A lot of donations we're still collecting, as I said, Facebook, GoFundMe, Venmo, Zelle, WhatsApp, Cash App, or even checks. So we accept all the stuff. And this is like, I'm asking anybody who knows anybody. It doesn't matter how much it is. Sometimes people give even $5 to buy one backpack. It will work. So we accept all the donation, and thank you everybody for giving us the opportunity to be able to support these children who have, probably some of them have never even held a backpack. So it will be a blessing for the person who is giving and for us to go and deliver that hope for that child so they can focus on school. And of course, we still collecting the school supplies and stuff. And sometimes people are worried about, okay, I don't know what to buy. You can give us the cash and identify where you want the money to go. Like say, I want this money to go to the backpack. That money will go to the backpack only. If you want to give the money to go to the whole medical mission, then yes, I will let you know where exactly we can try to send the money, and you'll be able to know where it is. Other area that we can find exposure and increase our visibility, community outreach, including visiting churches. Thank you, Ms. Valentine. So we were able to go last week to her sister's church. It's called the Salem Community Church here in Florida, and we had a beautiful service there. And I'm gonna finish up the video and share with you guys. Thanks to Dr. Vanessa Stenville, we're gonna be able to visit that church in Orlando, and we're still working on the content to send to the church and just increase the visibility. And just to tell them and what we do and share our passion, and hopefully we get a few people or a lot of people who wants to support us. When we were doing grants, we have learned that the corporations do want to help. However, they want something in return other than the tax exempt. So they want the visibility also. So they've been asking us the questions like, how many social media followers do you have? How many like YouTube channel visitors do you have in a week, in a month, in a year? So those are the things that we need to think beyond our just everyday donors. So we can ask people, when we post these videos, please share, and we post something on the YouTube, please watch those videos, because the more people watch, they monitor even how many minutes people watch. That's how we usually, if we plead with these corporations, they'll be like, oh, okay, so if I give you $10,000, $100,000, so what I mean, at least 1,000 people will see me. We're not there yet. We are at least subscribers, I believe, like 135 the last time I checked. So we need people to go on there, like for example, on YouTube, like, subscribe, and share for people, so people will be able to come in our channel and support what we do. And then when the corporations see that, they see there's more traffic on the website, on those channels, then they might see we are with them investing on us. So those are things that if you can, even if you don't have money to support, those are the little things that everybody, at least majority of us, have cell phone, just click and share, and wherever this part, few seconds of your time, you never know who you're gonna reach, and it might help us. Okay, any questions about that? Anybody? Are you guys can
Yes,
hear?
the corporate sponsors.
Yes.
What is the amount for the corporate sponsor? Can the corporate sponsor donate any amount?
Yes, they can donate any amount. For example, the few people we ask you for the grants, these are the questions they were asking. If we support the event, they say they give range $10,000 to $30,000, for example. We're gonna support only education. So tell me what education project you're doing. How many people are you gonna reach? How are you gonna evaluate? How do you know the content was transfer, knowledge transfer, skills transfer? How many lives are you gonna save? I mean, statistically. So those are the things that they want to see. And if how many people are you going to have who are going to teach? Let's say if I say one person is going to teach 100 people for a year, and I'm going to have maybe 2 super users or champions to go continue teaching when I'm not there, and then I'm going to reach maybe 500 nurses by the end of the year. And then so they're going to see, okay, 500 nurses translates to improve care of those 500 nurses. So the bigger the group you have, the more money you can ask, because they usually go and see, you know, the building capacity, how many people you have, how many people, and how do you create job when you get there. Like, so if you go and teach people and then become super users or super trainers, that means you've added them the ability to teach somebody else, even if you're not there. So that work you started is going to continue. And then for them, they want to see, okay, can they see themselves through your process? Like, means if I wear a t-shirt, it says their name. So that means I can publicize their names. If I do meetings, then I have to say, I acknowledge so-and-so for supporting that. So then they get more exposure. So those are the questions that they were asking. And then when you apply on those grants, they say like ranges. If it's annual, it might be like $100,000. If it's an event, it can go up to $30,000 if you meet these criteria. So they have specific criteria that you have to give in order to get whatever they want. And of course, that is just initial question back and forth. And then you have to be accepted. And then they will give you initial, like, okay, so now we accept, and then you have to go deeper to see what you're gonna be. And those are the time that they say, if we support you, what are we gonna get out of you? Then put them on the Facebook. How many people are gonna see us in the Facebook or social media or website? So all those things we have to collect in that part. So the amount varies on what the activity they want to support or what event or project they want to support. The one, for example, for nutrition, I think there was a grant that I think Ms. Valentine applied. That can go to from $30,000 to $100,000. It depends on what they want, and they want to see who is going to be providing ingredients. Where are they going to get ingredients? Are they going to get ingredients from local people? So that means you're supporting the local community, buying those ingredients for the event. I mean, for the feeding. So there's a lot of variation in there. Depends on what specifically they want in each grant. So we are trying to work as hard to try and explain that to them and see how much they want to give us. I hope I answered the question. Did I answer your question, Mr. Jones?
Yes, yes. I just wanted to know what it was, and you answered that question, so thank you.
Okay, no, thank you for asking that question, yes. Mr. Siakabe, did you want to add something there? I saw you coming close to the camera.
Oh, no.
Okay. Okay, so let's go back now to, now you got your ticket and then what? So to start with, we have 21 confirmed global volunteer. That means they have their ticket already on their hand. There are a few of them, 3 or 4 people are coming in, and some of them might get it today, and some of them might get, oh, I'm sorry, 22, the one from Tanzania today, he just joined. So we have a lot of different disciplines, and we have nurses, doctors, retirees, veterans, we have nursing students, we have professional athletes, administrators, teachers, auditors. I mean, they just keep going on and on and on. So as I said, we're fortunate and blessed to have that variety of experience or expertise from different areas, because our mission covers a lot. Yes, we are going to 3 acute areas, but also we are going to school and athletic group. So all those things help us to cover the acute area and the community outreach as our mission statement, that we have to be able to address both sides. Flights. So we thank Mr. Agent Nobel. We were able to use Turkish and Emirates Airlines to try and accommodate the volunteers. So the departure, majority of us are going to be leaving on the 10th, and then some of them in the morning, some of them at night. So those who leaves in the morning, I believe it's the Emirates, they're arriving on Tanzania on the 11th, which is the Sunday, afternoon or evening. And then for Turkish, the ones who are leaving in the evening, it depends on which state you're coming from. We're gonna meet in Amsterdam, and then after 3.5 hours, we're going to Dar es Salaam, and we arrive at very early in the morning, I believe 2:20 in the morning on the 12th. So once we get there, we're gonna have a real break, because of the time changes, more likely that 2 in the morning, at least for us, we'll be awake. But then remember, Tanzania people are sleeping, and they're going to wake up in the next 6 hours. So we're going to try, after we finish getting out of the airport, go to the hotel. It depends on if people are still hungry, get something to eat, and then sleep in at least a couple of 6 hours or whatever. And then lunchtime we eat, and then we're going to meet with stakeholders. I mean, like the leaders from 3 hospitals and school, just so we get to know them, say hi, and then because next day, everybody's going to be going around and around for where they need to go. Accommodations at Luther House. It's like a hostel. It's not fancy, it's not cheap, but it's the middle area, and it's safe, and it's Christian based, so it's a little bit more protected. I mean, we're in the area of the city that it's safe. So we're gonna get those rooms there. We have been communicating with them. They're waiting the final say at the end of this month to give the final number, so we can have everybody situated there. So we do have, as I said, like 4 more people are just waiting until they confirm with their tickets. So when we give them the number, the more people we have, we get some discount. So they know we already reached 20 and we're going up, and the original number I gave them was 30. So I'm hoping we get there, but if not, that's fine. So by the end of this month, which is like 3 more days or so, we're able to know the final number, and then we make those accommodation public to you guys, so you know for sure housing and everything else is going to be how much. Because remember, we're arriving at a different time, so some people who are arriving the day before, they might have to pay 1 night more than the others. But remember, when we did the math or the calculation, we calculated for 13 days, which will be exactly the same other people who arrive from the day before, and if you're leaving a day early compared to the other people. But everybody's going to be individualized, and everybody's going to be covered, so you don't have to start thinking about it. We're going to walk through your the budget, and then you see exactly what you have to pay and the accommodation, how it's going to be. So there's some people who are going to be returning on the 23rd, and some people who wants to stay in Tanzania and eat some more ugali, and then come back on the 26th. That will be the following Monday. So everybody knows, because they've already got the ticket for those dates.
I have one question, Dr. Gabone. The hotel that we're staying in is going to be like the second hotel we had from last year. Remember the one that we stayed in Dar es Salaam? It's going to be similar to that one?
No, not that fancy.
No, not that. Okay.
No, but
okay. Also,
yes.
Also, we had an issue with the internet last year. We're going to have that kind of situated as well. Do we need to provide a means for that?
So we, for the internet, they promised me It's gonna be secured, and for what I see, they have all this, you know, like online and internet and the Instagram and stuff. So I think they are better than the last place we were in Dodoma, but it could be close to the what Peacock has. So this one is a little bit more organized, I should say. So I did ask about the internet. They said yes, so, people will get the internet when they're in the building.
Okay, thank you.
You're welcome. Thank you for the questions. That helps people. We get more out of it. Okay, so now, as I said, at the end of the month, this in 3-4 days from now, we get the itemized list and make sure everybody who's going needs to get the invitation letter. So that's why I have my homework at the end of this meeting today. So things that I need from you for me to be able to get the invitation letter. So everybody will get invitation letter from all the locations. So that will allow us, if one day you're going to one hospital, the next day you're going to another hospital, you still have access and you're covered to go to those areas, including even the school. So everybody's gonna get the invitation letter. So you're gonna choose one letter and then apply that for visa, because all those 4 letters gonna have exactly the same content. So then we're gonna apply for visa, and then we're gonna show you exactly step by step what you need to do in the visa. So usually I walk you through, and Mr. Poranka is gonna help me. I have Miss Valentine's and Miss Catherine also will help me, because that time she was, you know, young people have way of technology, so they were able to help a lot of people very quickly to get their visa. So we'll do that when you get the invitation letter. Because the visa, you need to get the invitation letter to tell you where are you going there and who invited you. So we will show you, and when you're applying for visa, you're going to identify QHSC as a group you're going with. So all of them will be like tagged together. So there won't be any issue with that. Licenses. So this discussion is continuing. This license for the medical people. So for the nurses and the doctors, we are still ongoing in discussion.
I'm gonna get ready to leave and go. I'm gonna listen.
I have another question for her.
Oh, you have a question for me, Lady V?
Yeah, give me just a minute. Let me formulate this question with Steve right quick. Hold on.
Okay, that's right. So then for people who are getting licensed, as I said, the conversation is ongoing right now, and we will update you as soon as we can. We are trying to get a waiver, but we'll discuss that when it's time. Usually that one is going to worry about after we get the visa, because when you're doing the application, they're going to say, well, which hospital accepted you to come to Tanzania. So then we have the name, because by then you have the invitation letter. So those are things going step by step. And then so for the Tanzanian budgeting, like those expenses, we'd like them to have the 23rd. I know before I said, I think the 14 or something, that we just added just because people start getting the tickets late because of whatever the reason is. So we just want to give people enough time to be able to address those expenses for Tanzania. We need those money by then, just because so we can secure our location, so the price does not change after we start paying the deposit and stuff like that. But we keep you updated.
Okay, so Dr. Gabone, so my question for you is that, since it appears that I'm going to be coming, well, I don't know what the plan is going to be just yet, but I know it's going to be later than everyone else that I'll be getting my ticket. So if I'm not able to get the ticket on the same airline, Emirates or whatever the other airline is, will I have to kind of go a different direction altogether?
No, we'll try as much as you can to get you to either of those two, because then we want you to get with us at the same time. I think the issue is going to be just the amount, because as the time gets close to the date, the amount may be a little bit higher than now. I mean, we may be a blessing, you might get cheaper, I don't know, because sometimes airlines have crazy way of their tickets rates. So we're still going to try as much as we can to get you to those two airlines. And Mr. Bobe, usually he's good at that one, to negotiate and stuff with his airline, because I believe right now, this year at least, he was able to talk to them, and then so just to reserve seats, but he can't control the price. So reserving seat means if he knows somebody is a potential right now, so we can just let him know that this person is a potential, but she's waiting for either permission or something else. But that seat, he should be able to hold it as long as he can. before the airline say, you know what, forget it, we're gonna give it to somebody else. But
Okay.
yeah, so I'm assuming it's gonna be there, but we can still work on it, and then I will update as soon as we know there's any changes.
Okay. So as soon as I can find out something, I'll definitely be, you know, making plans.
Okay, perfect.
Right.
Thank you.
Awesome.
Thank you.
You're welcome. Okay.
Dr. Gabone, one more question on
Yes,
Friday
sir.
before we get out the accommodation. So I know last year we had Mama that was providing all the meals for us, and then we went to the other place. They provide the meals in the hotel. So talk about that, providing of the meals.
So the meals right now on this hostel, Luther House, they provide board and breakfast. And then so we need to pay for lunch and dinner. So right now we're making accommodation for, sorry, arrangement with the hospitals and it's very hospitals, because school usually ends at 2, more likely people will come back, either they eat at the hostel or we make arrangement. Nobody's gonna starve. So the dinner also, that's the part usually we're gonna make few arrangements. Some of us, I mean, sometimes we eat at the hostel, and sometimes we're gonna go out to eat different places. Like last time when we went different locations to try and get a different variety. So a few days we go out, a few days we're gonna eat there. We don't have a specific person to cook like last time, but right now it's the hostel, they provide their own buffet stuff. And I think last meeting we said if somebody has any allergies or have restrictions on the diet, I need to know ahead of time. And I did warn them already that some people might need specific diets and stuff. So their response, they said they're preparing buffet, so which is the variety of all this stuff, not mixing them stuff, because they need to know if somebody does not, let's say, eat meat, so they cannot cook the pilau with meat. They can cook pilau with vegetables to accommodate people who can eat that, but they need to know ahead of time. And we're going to start compiling the list and give it to them. So it's going to be prepared in one place where we are staying, but this is a little bit different compared to the one in Dodoma. And that's why the Dodoma, we wanted somebody to cook for, on our own. And on our global volunteer, we have a chef, very nice chef. So we're going to put her to work. She's going to cook for us for a few days. So we want to see her ability to cook Tanzanian food. So, but those are in the works right now. She does not know, but I'm going to put her to work to cook for us for a few days. But the food is going to be controlled, like where we are staying. And then lunchtime is going to be, because you're in a different location, we're going to make arrangements for each hospital where you're going, where you get lunch is specific area. Like it's a well-known area, not just anywhere. Because we want to make sure the food is safe where they provide, they prepare the food is safe.
Okay. Also, last year you gave us type of clothing to wear, hospital suits, uniform, whatever it is. You gave a jumpsuits, whatever the case may be. When I'm not medical, you got to help me on that one, okay? Anyway, so they're gonna be provided the same this year. We need to bring the ones back. What's going on with that?
I'm not sure about the jumpsuit.
Well, you know what I mean. The clothing that we wore.
I know.
I want a jumpsuit too.
Okay, no, Parag, it's only for me. It's only for me.
No, yes, you are going to get, we're still working on the numbers because there's a huge group of us. So we're working on the numbers. Definitely everybody's going to get 2 t-shirts and 1 set of scrubs. So I think last time people who were not in the hospitals setting or working with the patients, instead of a full set of scrub, we get the polo. So we're still working on those numbers right now. And as soon as we can, we're going to be able to let you know. But yeah, definitely you get the 2 t-shirts. And then either a full set of scrub if you're going to a hospital, or a polo for so you can bring stuff from last year. I mean, like for example, my scrub, the blue scrub, I wear from, I mean, I've been there almost 5 times now. So all those time, I just get the dark scrub to wear, because you don't want the lighter color because they get dusty and stuff. And the rest of them is hot, like Florida weather or Texas weather. No, maybe not to Texas, but just it's hot. So you're gonna be sweating and dusty, and you're gonna be walking, because the hospitals, like where the transportation ends, you have to be able to walk to the hospital. So it might be a little bit rough roads there to walk, but not a longer distance, just the dust and, you need to have that color scrub so it doesn't get dirty quickly. I need to, in fact, I need to ask if they have means to wash those clothes, because sometimes they don't. So we need to find out if they have like laundry services. Sometimes they charge, in which we need to find out if we can, if they do have it, then if they charge, how much is it? So people will be aware of, should I pack 7 sets of scrubs or should I pack 3 and then wash it in between? So we're gonna figure it out, that part.
Harriet,
Yes.
which is a perfect segue to my question. I was wondering, there's 21 of us going so far, correct?
Yes, yes.
Okay, with the fact that there's 21 of us going, and the way of life in America is a lot different than the way of life in Africa. So is there, I'd like to go, and since our whole purpose for going is to help and make improvements, I'd love it if we could make as small a footprint as possible while there. Is there any hints or ideas that you could give as far as lessening our footprint while we're there and helping helping the environment with Africa and not causing, not causing angst?
So, I mean, you have to give me a little bit more. What do you mean making a small?
For example, like you were talking about washing clothes. So in America, sometimes people just don't even think twice about throwing a half load in or throwing, whereas in Africa where water is really scarce, and that might not be a good idea. Is there ideas like that you have for all of us, as far as, this is not a good idea versus this is a good idea? You don't want to use as much water here. You know what I mean?
No, I understand. So for example, scrubs, that's why when we get clothes, we're going to decide how many scrubs you need, scrub set you need. Some people, I mean, usually they may, like if you have a t-shirt, so you have scrub pants, you can wear that, and then you have a scrub top and scrub pants, you can match it. So that means it's going to lessen some of the extra clothes. So if you say maybe pack 5 scrubs or pack 3 scrubs and then go and wash it. So in the city right now in Dar es Salaam, there where we're going to stay, they do have water. I mean, like every room, it's, like has a shower, bathtub, not bathtub, sorry, shower, sink, and like its own, everything is in the room, so it's all independent. We don't share. So like if you need to wash your clothes by hand and hang it in there, it's gonna dry because it's hot. They do have the little fans. I'm not sure if they have actual air conditioning, but I know they do have fans in there. So that will, since the weather is warm, you'll be able to wash it. Sometimes, I mean, like I said, remember we went to, I think, the second medical mission, Ms. Christine, we went to DCMC. They had a washing machine because somebody donated previous. So if they have something like that, then people can wash their clothes. But we're going to find out, because I have not asked about the washing machine, but we are going to try and limit as much packing and extra stuff as much as we can, the bare minimum versus having so much, because remember, we're not going on vacation, we're going to work, as you said, we're going to volunteer. So the bare minimum we can survive on, it'll be better. And then so that will help us not to like doing laundry too much, or, like do things like if we are in vacation.
Right. I guess that's what I was, referring to, right.
Yes, so there is, we're gonna give a list, like things like we need to pack, like a bare minimum we should pack, and which will help. And as I said, but I'm gonna still find out about washing the clothes, because as I said, it gets dusty and it's gonna be hot and sweaty. So we're gonna make sure, we don't want anybody wearing smelly clothes. No, we don't wanna do that. But we're gonna find out if they have that service or if they have the washing machine to help. I'm not sure, because sometimes the electricity might go or the machine might break down. So, but if people wants to wash their own clothes, I mean, it's just somewhere else, maybe do they have like a pressing iron or something like that? Because if you wash scrubs by hand, sometimes you get wrinkles. And as professionals, we don't want to wear wrinkled clothes. I mean, yeah, we have to be presenting ourselves professionals, even if we're coming for the medical mission. So I do agree with you that we can find out things that doesn't cause drama, but I think scrubs usually helps. And even if you don't work in the healthcare setting and you want to wear scrubs to school, that's fine. I mean, they're not going to say you cannot wear that. You just wear something that is going to be comfortable, because in school, I mean, bending over, kneeling down, sitting down on the ground with kids is the possibility. And especially people who are going to do exercise with their kids, probably might bring shorts or something like that to run around with them, or something like shoes to run to go and do your exercise with them. So those are things that definitely in the next meeting, because by then we're going to have people itemize where you're going, and you will know for sure where you are. I mean, what things you should bring to help or facilitate what you're going to be doing over there. So if you're doing exercise, maybe wearing scrubs might not be a great idea, because you're going to be running around, and so you have to find something that is going to support your activities, as I said, jumping up and down, bending over, and something like that. You don't want to wear jeans in that part, no. And I would discourage you wearing jeans when you're going to teach or in a professional area. I would discourage that. If you're going shopping or going to the safari, you can wear whatever. Usually we encourage you to wear long sleeve clothes, because of, you know, like mosquito bites or something like that. But we want things that is going to accommodate the activity that you're going to be doing. Okay, those are great questions. What else?
I had one more suggestion.
Yes.
If anyone is going to get a laundry service, make sure that that you understand what they're saying and they understand what you are asking, because the miscommunication sometimes, when you get the total, you'll just be shocked.
So what she's talking about, the last time when we went to the hotel, it was a Peacock Hotel. It was a nice hotel, better than the other ones, but they offer laundry service. So, and they put things in dollars, because they think people who are there have lots of money. So even probably if you put like an underwear, it's like $2, but if you put 10 underwear, that's already $20 like that. And so things accumulate. So that's why she said, make sure you understand. And as I said, I will try to get as much information as I can, but if we were there and you're talking to the server or somebody in the hotel or hostel and you don't understand, please let me know. We're gonna have probably 5 or 6 of us who are going with you and speak Swahili. So more likely you can grab one of us and say, you know what does that mean? And then so we want to make sure we don't want miscommunication and then end up costing you money. We don't want to do that. And sometimes it just maybe we have to ask the right question to be able to get you a service that you need. So we keep going, and as I said, more meetings. And thank you guys for asking those questions for people who went last time. But that helps for the new people to know what they can expect, what they can ask questions like that. So I appreciate that. Okay, any other questions? Okay, so I'm gonna go back to my list.
Okay, one more thing. Here
Yes.
it is. And this, I guess this is for those who may have never gone before.
Mhm.
What happens if I get sick or something happens to me? What about the medical? How I get medical treatment?
Yes, that was my little next thing. So let me get to that. Thank you, Mr. Jones. Let me get to that one when we're talking about the insurance in like probably a couple of pages then. I'm getting there. Let me see my screen so I can show you. Okay, so let's get to the preparation. So everybody should have passport, I hope. In fact, I need to check mine. I don't know where it is. We got the tickets. So the next thing is the travel medical insurance. For travel medical insurance, we encourage you to get the travel medical insurance under the 12-week International Safe Travel Explorer Plus. So this insurance covers quite a bit on your ticket. So usually ask you the amount of the ticket you paid, and then it covers from there, because usually if there's any triple cancellation, So you get the actual amount you paid for your ticket back 100%. If there's an interruption, I mean, the weather, whatever, 100% of your ticket will be covered. Medical evacuation. So something happens when you're sick and we need to get you back to US. They cover up to $200,000. So that's the part which, I mean, you can evacuate to get maybe the flight services, get you to, thank God we're right there on the hub that there's a number of airports. So we get you back to United States. Emergency medical. So if we need to stabilize you first before we get you out of there, they cover up to $50,000. So $50,000 is a lot of money for Tanzanian part, but we want to make sure you have some coverage there before we get you out of there. And then if your bags, if there's something is lost, they cover up to $750 per person. And then if there's any accident on the flight or whatever, then they cover up to $20,000 per person. If accidental death, I mean, it's not covered because they're just focusing on the traveling part, I think. So majority of the people who are young, to get this insurance, they were paid like $25. I think the cheapest one, I think is $21 or $22. And then I think the most, for what I've known so far, we paid like $45. So that's the part which, if you pay that, you're going to get this coverage between that time. So when you're putting the date and time for your travel, you put 9/10 and 9/27. That means you have to make sure you're already back into the country. Even if you're on route, going or coming back, you should be covered with that. So it depends on what the days you're putting in. Then they're going to hold us to that date. We're going to pray that nobody's going to use it, which is fine. But if we need to, and absolutely need to, then definitely we have the coverage. This is the reason that I want to have your contact information for a person who is back here in Tanzania, in US. So if we need to contact them and let them know something else is going on with you, I need to be able to reach them. And then also you guys, you have to give them my number and Mr. Poranka's number to share with them. So if there's any emergencies or anything else like that, we can tag team and try to help you as fast as we can to make sure we get you out of there and then get you back home and get the medical services you need. So that is very important. So as soon as you get your ticket, please get this insurance, because you don't want to wait too long from the day you bought the ticket to the day you get the you buy the coverage. They're going to start adding money to you. For the sum of insurance, we say put the day that you bought the first deposit. So the first deposit of the ticket, that means the day you put the ticket. So if it's like a month away, they're going to be like, you might see your prices is higher than $45. And if you are young, you should get close to $20, $25 to pay versus $45. So that's just the one. And thank you, Mr. Jones, for asking. Yes, this is very important. We want to make sure you're going somewhere safe. And if we need to get you back home, then definitely we'll get you back home using this insurance. And that's the part which, once you get this insurance, please send me that email. It's called the enrollment email. It has 3 attachments, and I need those attachments because it has a policy number, contact information in case of emergency, contact information for questioning, and contact information for email to send a document. For example, if you are sick and we have documentation that you're in the hospital, they need to evacuate you. We need to send that information fast so they know for sure and activate whatever, allow the money, whatever, to get that person airlifted to where they need to go. Any questions about that?
Okay, bottom line up front, they're gonna take care of everything basically if we get sick. That sounds good. Yes. But to get the form, are you gonna, you say we send you an email to get the form, or are you gonna send the form out?
Oh, the form was in the bigger document. I can send it again. It was in the bigger document I sent like last month, I think. But I will send it again. Let me put it here.
Okay, okay. Yeah. Thank you.
You're welcome. So send the link. I'm gonna send it to everybody, so just in case. I mean, I know some people have already gotten the ticket to okay. Yes, so at least it will be covered that way. And let me see, go back to my real screen. So for visa, yes, so we're going to do electronically, and we're going to walk you through, guys. And then the license, we already talk about the nurses and doctors. We're working on it to try and see if we can get exemption. And then, so please talk to your doctors to get the vaccines and anti-malaria. That is important because you have never been there, some of you. So you don't have immunity to mosquitoes. Mosquito are there, whether you like it or not, they're there. So we need to get those medication, the anti-malaria medication. So there's 3 kinds. This is according to CDC. And if you're a doctor also, or nurse practitioner, we go to the website of the CDC website and go under recommendation for Tanzania. That's the part which we got that medication. It's on that document also. If I send it to you again, you guys will scroll down, you can see I put exactly the medication that you need to ask for the doctors. It depends on what your medical background. They might choose one medication that you get every day, or they might choose the medication that you get once a week. So if you get the medication that you choose every day, I believe they ask you to take 2 days before that, and then every day when you're there, and then 2 or 3 weeks after when you come back. That's what your doctor is going to recommend. Or if you're taking the weekly medication, you might take it the 2 weeks before you leave, 1 week before you leave, and the day that you are leaving, and then every week when you are there, and then 4 weeks when you come back. So they might give you probably 9 or 10 pills. You need to get them early on because it's not so common medication here in the United States, so they have to order it. It might take 2 or 3 weeks. It depends on where you are. So ask it again. And sometimes because it's the 8 pills or 9 pills, insurance, if you have insurance here in the United States, they will assume that medication is 2 months. So they only allow a month, prescription to get the medication. So getting the medication now to the pharmacy, at least they will say, okay, June, you can get 4, and then July, you get 4. You collect them and keep it with you, and then you start taking one before you get. So don't wait until the last minute, because they might give you, like in August, they give you on a 4. And then they say, oh, come in September. You'll be like, no, I'll be in Tanzania. They'll be like, oh, maybe then you can take when you come back. But you don't want to miss it, because we don't want the mosquito to bite you and you get the malaria. So if we can prevent, please, let's get those medication now, and then as soon as we can. The vaccines, some physicians, we have them with them in the office. They just say maybe come certain days so they can get your vaccines ready. But sometimes they may send you to the travel agency to go there. So just try and call ahead before you go and ask and see where it's cheaper to go and get it, because sometimes if it's the area that they don't have any international people or travelers people, then the prices sometimes they're a bit higher than necessary. But you have to call around and see what they offer. And I said some providers will do it in their office or clinic, or you said nurse appointment, then they will give you those shots, and then they'll be covered with your insurance if you have insurance here. If not, they will send you to the travel agents clinics, and then you can get there. You don't need like in the doctor's order, but the doctor usually writes, so then they can give you this vaccine easily. We're going to discuss about clothing. As I said, we're going to try to pack bare minimum, because I know some people wants to go and shop. Tanzania have beautiful clothing, so you can have clothing over there and buy over there, or order them before we get there. We give you more information as the days gets closer. And then this is the part which I said I put the accommodation of 15, but I added more days up to the 23rd, so just give more people time. Any allergies, please let us know so we can address and make sure we avoid anything that may make you sick. We don't want to do that. We want to make sure you experience the food in Tanzania and then accommodate as much as we can. And if there's maybe something you need and we can't have, then you have to probably find some alternatives, and then knowing ahead of time, so then you can maybe some of the things that maybe supplement or something you can pack with you, so you don't lose it, you don't miss whatever you need to get. So that part. Everybody has a phone, iPad, computers, cameras, whatever. So electricity is different. We're gonna need adapters, and I think Mr. Prank, can you share that adapter, like the web link from the Amazon, and then on the group when we're done the meeting, so people will know how it looks like, and then so we can get that, so when you're plugging in on the wall, so we don't destroy your devices. But you have to make sure don't plug in directly from your charger to the wall, because the electricity is different. So please be careful. We don't want to mess up your stuff. Okay. This individual prices, this is I gave you guys last time. So chances is, there's some prices are changing. As I said, by the end of 3 days, when we have an actual number and secure those prices, then I'm going to give you an update. And also it's going to relate to how much you pay for your ticket. So the lower the amount, then the means chances you're getting less and less amount. When I put in miscellaneous $150, you're not going to use the $150. But if you are somebody who loves shopping, you might use $600. Remember, for insurance, this was from last year's estimate. Like it was going up to $61. But as I said, for this year, for me at least, I got for like $45 or $43, I think. So most of you guys will be like, that amount will go down to 25. So that would be less money. The visa is still $100, so that's, of course, everybody's going to have to pay the $100. The license is going to depend. If you don't have a license, don't worry about it. The food and dinners, you can see lunch and dinners. So 2 meals, each meal is 1,800 shillings, which is kind of $9 times 2 times 13 days. So I put in there in a sense like we're going to eat breakfast, lunch, and dinner there, but we are not. I mean, this is just for estimation purposes. We are going to eat some dinners somewhere else, you know, like out of town, so you can go and see the city a little bit and then enjoy different type of food. And then, but I just put it there so we can have an estimate of what people we need to pay. And then, of course, breakfast for the teen, bed and breakfast. I'm sorry, I'm like, what? So the rooms and included breakfast is $30 for 13 days. Then it's calculated there. You can see breakfast for the second person. So people who are sharing rooms. So the second person, we add $7, which will be added. So as I said, it's going to be individualized. So for a couple, you will see that $390 plus 91. But as I said, we give you the amount individualized because things depends on if we're 2 people and this is only 1 person. For the safari, there's $380, but now we've not secured that price yet. That's a tentative for that time when we were making arrangement. We're gonna try and go to the safari there in Dar es Salaam. It's a little bit ways, I think 4 or 5 hours from Dar es Salaam. It's something that we wanna go and see what the nature has in Tanzania, there in Dar es Salaam. So there's few things that I'm hoping you guys are gonna enjoy. And then of course, when we're traveling to that day, to the safari is like $30. So as I said, all those are not finalized. We're going to figure it out once we securing the location and stuff and order the food even before we get there, so we know for sure how much it is. And then of course, meals and outing, we usually get, as I said, it's some fancy area so you can see how different type of food people eat in different locations and what activities they have in the city. And then, so that might not be $70, it might be less than that. So once we figure it out, because we are so many of us, we're negotiating the prices where we go, we want to make sure we get less amount there. And then the meals, the COVID, this one is going to change because I know they're saying $100, but there was a discussion that will be $50 by June. I'm waiting for that price to drop. So if it drops, it's going to be half of that. And then we're going to have less amount there. So for now, at least the maximum, if you have a license and stuff to pay for the expenses for Tanzania, it's going to be $1347. But I know it's going to be definitely less than that, probably for $100 to $200. It depends on if there's 2 people or 1 person. So we are still working on it, but definitely it's going to be less than $1,300. So I said that's just an estimate, but we're gonna know that part. And then so if you check the amount that I'm paying for my ticket, insurance, and license, and the accommodation in Tanzania, that's $26.57. As I said, last year I paid $28.86. So it's less, but I believe it's gonna be less than that, 26 also for this year, including everything, like including the ticket and everything like that. So we are hoping and we're praying, and that's why we want those corporate sponsors to come and help us so they can help us to get less, reduce the amount for expenses for people going from Tanzania, from US to go to Tanzania. Now the homework part. Oh, sorry, let me ask. Any questions before we start discussing about the homework? Can I see people? Any questions before we discuss the homework? Nothing?
Did you want to see the the adapter or the converter? Or
If you have it right now, yes, please.
I think I do. Hold on. Let me see. Okay, can everybody, I guess, see this?
Yes.
Okay, so this is just a kind of like a similar adapter that some of us took last year, and you can actually use it in a lot of different ways. There's different holes and different prongs, so if depending on what country or outlet you're using, you should be able to make it adjust. The one that we use, I believe, was this one. That's the one that we use over in Tanzania.
Yeah, for the UK, yeah.
Yeah, and let me see if I can find the USB. It's got the USB chargers on it too.
On
If
the
you look
side,
over
yeah.
to the side here, yeah. So,
Yeah.
so you can actually. This is only for one appliance or whatever you want to call it, or at least one at a time. And if you look there, it tells you not to use high-powered appliances with it and stuff like that. And then there has a little switch that'll actually push the prong out for you depending on where you're at. So
Yeah.
and believe it or not, as you can see the USB cords there, I actually took an extension cord with multiple outlets on it too, so that so you're not just stuck with one adapter. So, and they're not that expensive at all. Let me see if I see the price here. It says
It's $19.
$19.99. Yeah, and I think you can get them at Walmart too. In the travel section is probably cheaper, or maybe about the same price. But yeah, if you have two of those, that'll be good. One is fine too, but you can also get an extension cord to go with it. What do we got? Let me get Bree in. All right.
Okay. Thank you.
Alrighty.
Yes. Okay. So my favorite part. Don't think that we're gonna be working too hard without having fun. So this is just a little video before we get our homework. So that's the part we were just finished singing. We went to do the prevention of minor injury for the soccer athletes. And so when we finished and they had a birthday, so we were like driving and singing and dancing and eating cake. So we're not working too hard without fun. So we're gonna have a lot of fun. That's just one of the videos. And some of them, the gentlemen there, you can see a lot of them were coaches for that team. And then on the other side, you see the volunteer, everybody was dancing. The one with the mic was one of our volunteers last year. And then so he was singing it in Swahili, although I don't know if you can catch the words, but he had too much fun too. So there's hope for everybody. Okay, so let's go to our homework. Okay, so for the homework, what I need from you guys through my email, because this is the information that is going to help me to get those invitation letters. So I want a passport number. I want a copy of the page that have your picture on it and have the expiration date and times and date and when it was issued and stuff. I need that part because of the invitation letters, because they need the passport number to make sure they link the person and the letter. And then I need also another passport size picture. So we're gonna create a badge. So everybody's gonna wear a badge that has saying the QHSC and the credentials. So because we wanna be identified as a QHSC when you're walking around, just in case if you get lost, then they can say, oh, you're with this group, you need to go here. So I need those pictures too, so we can start working on it. When you apply for that travel insurance, I need that email enrollment email. I need that because it has 3 things that I need for your medical coverage if we need to use it. So usually those things I printed out and I keep it with me, but you need to have your own copy just in case. But I always keep it just for the organization standpoint. If we need to access that information and reach back to the company and for your family member, I need to have all that information with me. I don't want to start looking for it. Or you need to just forward that email to me, to that email address there. I need a copy of your COVID vaccine because it's still, yes, the COVID is going away, but for me to guarantee you going to the hospital, I need to say we have some level of protection from all my volunteers. So we need just take a picture of the front pictures to show the dates and times and wherever you got them. I need you to send the emergency contact. As I said, that person, I hope they have WhatsApp. Also, if they don't, just tell them to download the WhatsApp so we can communicate with them easily if we need to. But most of the time also, we're going to encourage them also to join the WhatsApp group, the QHSC friends and family, I mean the members, because we're going to be posting a lot of update there. So if your family members are in the group, they can at least see what is happening and they can, because they're going to worry. I mean, some people have never left the country or even a state. So they're going to worry that you went to this country, they have no idea where you are. And if they don't speak with you in a day or so, remember there's time difference, people get worried, like, okay, I didn't hear them from the last 12 hours. Yes, she's been sleeping. It's not like she was awake, but remember, people in America, they'll be awake, people in Tanzania, they're sleeping. So if they're trying to contact you, and if you didn't tell them the time change, they're going to be worried and start calling me, which is fine. They can call me if they have any issues or concern. But just make sure we're going to have to run through, okay, if it's this time in Tanzania, this is time in America. So you know, you can tell them so they don't get worried about it. But if they join the QHSC from friends and members, then they will get those updates. They will see exactly if we are awake and posting these things. We're going to have our media group posting those things routinely, either on the social media or on the group, just to keep up with them. And people need to see their family member presenting or teaching or jumping up with the kids, then we're going to do that. So they need to be able to see that. I need t-shirt size, you know, should be loosely fit, t-shirt size, and then scrub size. So when we order those things, we want to make sure they fit everybody. So you're going to get 2 t-shirts as of now. If we are blessed and have more money, then you might get 3 t-shirts or 4. So to start with, we need 2. These are the t-shirts, like those days we'll be taking pictures as a group because we have to show the uniformity of as a group so we can be identified as a group. And if we don't have, okay, other days that you don't have like actual t-shirt, you can wear one color, I mean, plain t-shirts, and we're going to have the badge. Everybody's going to be having a badge, and we have the, what is that, Kaka? What else do you need to give them to wear? The button. They're going to have the button also for the QHSC. So at least we have some of kind of identification so they know who you are. What I need from you also, I need 2 to 3 statements of why you're joining the medical mission or the reason you're going to become a global volunteer, something that we can use with your picture to say, to talk about the mission and thank you probably the people who have supported us and are supporting us right now. So it's just gonna be like publicized in the social media and everywhere else. So when you send the picture, have that in mind that it's gonna be shared everywhere. So decent picture that shows your professionalism. Let me see. The last thing is we need to sign the 2 documents, which will be probably in July. We sign those documents. One of the documents is just like make sure when you have whenever things happen during the medical mission, those things are done in the interest of safety for you. So we're not going to do anything that may jeopardize your health or your safety. I would never send you anywhere where I cannot go. So if we are there to those standards, and if you ask me, you want to go somewhere else, and I said, please don't go there because I'm not sure, I can guarantee you are safe to that area because I don't have one of people to come and make sure you're safe, or I've not been in that area. So I don't mean to just cut you off not to go somewhere else. I'm thinking of your safety. So let's stick to that and make sure everybody is safe. And I want you guys to live here and go there safely and come back to your family safely. That is my goal. So when I'm advising, let's do this or let's not do that, it's just because I'm thinking of the safety, not because I don't want you to go somewhere where you want to have fun. I know sometimes people start getting making friends very easily. Usually that happens. The people from Tanzania are very friendly, and they will try to welcome to their house. And they will want you to go with them. Let's go shopping. Let's go in this. Please don't do that. I worry because if you go with somebody who, first of all, I don't know, and then if you go there and you are in trouble, language is going to be it's a clue for me to finish. Yeah, so for your safety, I don't want you to go to anybody. So I met this person on the Facebook or wherever, so they're going to show me wherever they live. Please don't do that. I know I said people can be very friendly. People will want to make friends with you. They're going to want to show you the city. Please don't do that. If we want to go shopping or we decide that day we're going shopping, I will make an arrangement. I will have people who I know for sure they're going to make sure you're safe and bring you back. So just let's have that in mind. If you have you've secured a meeting of somebody else, just please let me know. Let's talk about it. If somebody wants to come and visit you, then let's see. They need to come through the proper channels if they're coming where we are. We don't want to just disclose to anybody else, yeah, this is where we're going, I'm living in this room, so and so. No, we don't want to introduce those things because your safety and everybody else's safety is important to me and for the organization. So I want to make sure you guys are safe, but also make sure you guys will have fun because I like to have fun. So I work hard and then we can go and have fun, but we have to be in a control situation that ensure your safety. Okay, so those are things that I prepare for today. So I'm all ears of the questions. I know a lot of things. I mean, I just say right now, and a lot of things are going on. Please ask the questions. Any questions? Don't say like, oh, I don't want to look stupid. No, please just ask. Because probably I didn't address that question, so I want to be able to express it to make sure you all the questions are answered. And probably we can learn from it and probably expound on it and make sure we address and everybody else get the answer. So I'm all ears now, please. The first question is, what are the questions? So everybody's ready?
Good morning.
Yes.
No, I'm not. So I got on kind of late. So if we are planning to room with someone, like I was planning to room with Hunter, do I count her as my like +1?
Yes, so then those are the ones that where it says accommodation. I add your one person plus the second person, then divide by 2, and then you guys can share that cost. So it's gonna cut your cost for a certain amount, yeah.
Okay, and then you say you'll have the finalized cost to us by
next year. I'm just kidding. No, probably by the end of the month. I'm like probably next week, yeah, because as I said, we put a deadline up to the 31st. I know they said there's 4 more people are having that, because usually they go and tilt to some of, like, for example, Safari or the hotel. I said, if I have more people, can we get more discount? Because we're gonna occupy more rooms and stuff. But yeah, so I'm working on it. Probably definitely by next week we have that amount, and I'm trying to get it as fast as I can so people can plan ahead. So they said, just for thinking ahead, just see that $1,300, but it's going to be definitely less than that. But if you are aiming like, okay, how much do I need to get for Tanzania? Think of the $1,300 or less. So if you are aiming that, but definitely, if you get more, then you will go shopping. Or you share with me.
All right, one question. So
Yes.
how are we rooms? Is like, I know, like here, you know, if you have a hotel, you can get like 2 queen beds, so it's technically you can fit 4, but I'm not sure how that works there.
So I believe one room has 4 by 6.
What?
The bed is 4 by 6. I think is it like full? Not full,
Oh,
like
is
a queen,
it a
but
twin?
it's like, huh?
Is it like a twin bed or a full-size bed?
I think it's
Yes.
full.
Okay.
Yeah, I don't think it's a queen bed, no, but I think it's full. So that's the size of the bed. And if the shared room, let me ask them if they have the 2 twin bed.
Okay.
It might be an issue because it's a small, I mean, rooms are not that big, but I can ask just to make sure. If they do and people are sharing, then why can't we? Yeah, that'll be the better way of doing it. So thanks for the question. I will ask that one, yes.
Dr. Gabone, will there
Yes.
be water excursions? Anything containing a body of water?
Sorry, because the last year I didn't tell you that.
Right.
Okay, as far as I know right now, it's involved, you know, like the animals moving from one area to another. And then the second part, I believe it was hiking, which I'll be taking pictures of you guys going and come back. And then the
cool.
third part, I believe, was because the safari, I mean, the national park touches the water, the Indian Ocean. So I believe that water also is just like a walking versus.
Right.
But also, I know they have like a route to go to the island, like from where we are to inside. So I'm going to ask and see if it's going to be included in the package. And so people probably who wants to go, they can go. But as I said, the same thing, I'll be taking pictures if you're going to the boat.
Yes, I just want to prepare my heart. That's all.
Okay.
Hey, what did you say the first part was?
Huh?
What did you say the first part was?
Oh, for the safari?
Yeah. Okay, so the first part is safari.
Just, yeah, so then the animals, you know, like from one area to the next, hopefully they're there. And if we go early on, because we're trying to go Saturday, sleep over there and then come back. So Saturday, probably early in the morning, Sunday morning, and then that's where we go to the safari. Because sometimes the animals, you can see them in the morning before the sun comes out. So then we can see that. But so the day we are going to safari, we have some activities we have to do. I have to leave those, some of them secret, so you can be surprised.
Right. Okay. So I just wanted to know how to prepare my heart and my, you know, just all that.
No, I should ask you, is the boat involved? Okay.
Yes, is there a boat involved? Okay, I'm good. I'm good.
Okay, good. I'm not sure if they have life jackets, but if they do, then we can ask people to take their life jacket with them.
No problem. I'm good.
Okay,
all right.
Good.
Thanks.
You're welcome. What are other questions, guys?
The more water, the better, Dr. Gabone.
You said water? Oh, water for the safari? Oh, no, she's the daredevil. No, I'm like, yeah. She jumps and stands.
Water.
You can like, I'm like, you don't even have the harness to hold back. No, I'm like, are you asking for trouble? No, but that's okay. I will be taking your pictures. That's okay. You can do all this stuff. I will take a picture going.
Okay, I'll do it just for your entertainment.
I'll be praying for you until you come back, but that's okay. Okay, other questions?
Dr. Gabone, in the hostel, does each bed have a chandelier?
I believe so, yes, because I did ask them about the mosquito net protection and stuff. And I believe in the evening they spray whatever it is. And so I told them like probably to spray when we go to eat. So when we come back, you know, like that fumes and stuff at least dissipate, but at least keep the mosquito away, yes. Yeah, because in Dar es Salaam even has more mosquito than Dodoma. Just because I think there's some standing waters and it's close to the ocean there. I think some places have like just a package of water, which is just becomes a hub of those mosquitoes. So yeah, so especially like in the evening, if you stay outside, oh, so then you just pack a mosquito repellent. That's the usual is the next meeting, but yeah, the mosquito repellent, everybody should have that. Sunscreen, because it's like a direct sun, like on your face, because it's like right there on the equator. For people who know geography, right, Marcela? Yeah, so you have to study geography, so you know where it is.
Okay, so everybody make sure you pack some mosquito repellent. Don't put it in your carry-on unless it's a really small amount, because if it's too big, they're going to take it from you.
Sorry, I missed that, but what did you say, Frank? The mosquito repellent, that's what I think I heard the last thing.
Oh, no, I was just telling everybody to make sure they pack some. They actually took mine on the way back, but to pack it in their luggage, not their carry-on.
Okay. Oh, no, yeah, that's true. Anything less than 3 ounces, I think you can keep, but put in a bigger suitcase. We're going to get them before we enter Dar es Salaam, so you're gonna have your stuff with you. So put in the check-in bags.
Oh, I have one more thing I wanted to add.
Yes.
Are we still looking for notebooks?
Yes.
Yes. Target is starting to have the sale. They're 50 cents right now for the black and white marble notebooks.
Okay.
And then soon after that, they like the next month or so, they're going to have the sale where the spiral notebooks are 25 cents a piece. So
Wow.
for whoever has room in your luggage, they just go and buy lots and lots of notebooks.
So thank you very much, Ms. Christine. In fact, that's the part which we I was left with shipping and stuff. So we do have the shipping set for the 10th of June. But the things that I have here in my house, they have to be shipped or taken out by the 6th. So they can get to Maryland and then he can ship it to Tanzania. So we are trying to get, if somebody has like a bigger package or bigger boxes and they need to ship, either if you are here in Florida, that's great, just give it to me. If not, then we just need to ship it to that guy straight so he can get those things and take it to Tanzania. The next shipment is the end of the month, like the 24th or something like that. So the problem with that, the second shipment is it gets there the last week of August. So there's no guarantee that that 1 week or 2 weeks in September, things will be cleared and come out. So that's why we were trying to get things as much as we can. We ship this time and then whatever we get, and I'm sure we're gonna get, because when people start hearing our stories, then they're gonna donate more stuff. That means we have to pack with us and take it with us. So that's gonna be a little challenging because if we get too much, then we opt again to shipping to that guy and then hope and pray that we get them when we get there. So that's the challenge there. But yeah, so the shipping, I mean, they charge quite a bit. So I am grateful that Mr. Poranka here is decided gonna drive and come and help me unload all those things to the truck and then take it back to Maryland. So thank you.
Do you know the date that they're going to pick up in Pittsburgh?
Oh, so he wanted the address, and he said we're gonna give the address to pick it up in the middle, because he usually go and pick up in the houses. But I said, no, you're coming from Buffalo. And he said, okay, so then we get the date. That was last night when he responded to me. That we can get a spot in between where he's going. So yeah, so then we can talk after, and then I can share with him your address and see on his way around where is convenient for you and which day, and then so you can drop them off. That would be a great help there.
Oh, great.
Yeah.
Do we still need more toothbrushes too? Because
Yes.
I was gonna try and get more of those also.
Yes. And then so in fact, I do apologize. I know people keep asking me how many people. I had the spreadsheet with all the things written down. And then Digital World decided to teach me a lesson, and I need to upgrade to Digital World, I think. So my backup drive died, and I lost all the document and stuff, all the accumulation, all the counting stuff. So, but I'm working on it. I'm gonna try and get that list definitely this coming week. So then we know for sure. But as of now, I can just guess things that are looking in my garage. We do have close to 100 to 200 crayons. And I know somebody is going to donate, I think, 200 of the crayons. We're just waiting. They're going to be delivered in the 2nd of June. So I will update you guys with that. So we do need pencils. I know Ms. Janet donated some pencils, and I think Maricela donated some pencils. we are planning to give those kids, those 830 kids, each at least 3 pencils, because 1 pencil does not last in a day for these kids. They're gonna probably sharpen once to play around with the sharpen, new sharpen. And the pencil is good. So if we can get them at least 3 pencils each, that would be great. And then we do need the erasers. We need notebook, as Miss Christine said. We do have the initial notebook that Maricela gave, I believe it was like 34, something like that, close to 40 notebooks. So the more we get, the better. At least if each child get at least 1 notebook, that would be great. The newborn stuff, the hat, we have great return because everybody wants to do those meetings hat. We wanted 300. We have close to 1,000 right now. So if anybody is thinking for the hat, please don't do the hat. Do something else. Those are the booties. I mean, that'll be fine. Mittens, that'll be fine. The blankets we have, I believe, close to 70 something, 78 or 79. So if we can get more blankets, that's fine. As I said, our original goal was 300, 100 of each hospital. And these are the babies that when we are there, they're delivered. So those are the ones when we're teaching, we want to give them like the whole bundle. The hat, the mittens, the t-shirts, the cloth diaper, booties, and blankets. So if everybody baby has all that set, we met our goal. So that would be great. Let me see what else. For postpartum hemorrhage, I know we were talking about looking for those chucks, the pads, peri pads to help. We do have urine catheter, quite a bit. I think we're close to 100 and something. So for 3 hospitals, at least each hospital, hopefully they will get 30 to 40, because we're going to teach postpartum hemorrhage. We're going to use that to show them how to do it. So those are things that if we can add more, those rubber catheter, that would be great. As I said, I'm going to give you that list probably within next week, and then we know for sure where it is. The backpack is already ordered, so we just need more money to add to that, so we can offset that price. And so if people are asking you what exactly do they need, you can say that you can donate the amount of money to school supplies or amount of money to baby care with immigration. So whatever is left there also is going to cover the shipping. So that's the part we can do. Versus if they want to ship something, because we can order quickly and add it to whatever we have, versus people wants to donate individual item. However, some people are adamant they want to give, okay, I want to give 10 onesies, this kind of onesies that then you should go to the kids. That's okay, we take them. We take them because that's what they felt they need to donate. That's what we're going to do it. That's fine. But if they give you an option or they're asking for options, then yes. And we have those Zelle, Venmo, Cash App, PayPal, and actual check, like writing a check. We still have a bank we can go and deposit. So all those things that we can do to help. And if somebody wants to donate for the whole mission, those are the amount that usually we help with the scrubs and stuff. So instead of people paying out of pocket, then we just help. Instead of just maybe 2 t-shirts, then we get to 3 or 4 t-shirts. So those will help just to unify us and still allow us to work in the hospitals and in the school. Any other questions? Anything that you want to ask? So everybody is ready. Everybody has a passport on their hand. I need to go and find mine first. But anything else, guys? I don't want to keep taking your time, but so if yes, go ahead.
You have all my information, correct?
I'm sorry, what did you say?
You have all my information already, correct? Or do I need to resend it all?
No, if your passport information is not changed, then I do have that. All I need is the enrollment for this travel insurance. I will need that. And then I need a picture. I need a, did you give me a t-shirt size? I think you did, yes. And then I need a statement. I mean, like maybe another statement for you being in the mission, being a veterans for our missions. Yeah, so for the statement, I want you to either record yourself speaking, so we can have varieties of voices, faces and stuff. Or send me a selfie or a picture, which is a decent picture that we can use, or two of them, and then record yourself audio. So then I can play around with those pictures with your audio. Because I want you to use your voice versus my voice. I want your voice to be advertising. And I want to use your words and your passion for the medical mission. This is me saying, oh, this is Maricela, this is a nursing student who wants to go with me everywhere I go. No, I'm just kidding. Yeah, I want your voice, your face, and because we're so blessed to have you guys. So thank you for wanting to join this medical mission. Any other questions?
Dr. Gabone, so
Yes.
for the people that we have to like add to the group, do we send you their number so you can add them to the QHSC group? Right?
Yes.
Okay.
Yeah, if you send me the WhatsApp number, I can just add them. Yes.
Okay.
It's nice for them to see what is happening, because remember, as I said, I would say 90% of you have never been out of the country. So it's nice because the family is going to be worried. You are going somewhere else, all they see is a geographic picture on the whatever documented. That's what they see Tanzania is. But it's more than that. So if they can come and learn and see what we are going to do and how many people we're going to impact, and your presence going to touch a whole lot of people and bless a lot of people who otherwise would never have a chance in this life. So if the family member or friends can come and see that, that would be helpful. And that's the part which I'm saying, share it on the social media or wherever to give to get our QHSC exposed so people will know what we do, and then they'll be willing to help us and support us and join us also, because we want them to like, share, and subscribe to our network. So when we are asking those big donors, we can say, yeah, we have 1,000 followers. Yes, so that's right.
Dr. Gabone.
If they have, if any of your family members and friends have Facebook or social media or YouTube, have them, I'll send out the information again, have them like and subscribe or follow or whatever it is. Either of those pages, because sometimes when we're there, we may start live streaming, and that way they can actually not only just hear and see the messages as they're coming through, they can actually see what you're doing and see how you're involved or what we're doing, stuff like that. So
yeah, and I have so many.
We'll take them with us.
Yes, we do, because when we right now, I say we have so big group from different areas. We're gonna just start. As soon as we start packing our bag, it's gonna be over. Like, it's gonna be everywhere else. Bags, weighing stuff, all those things have to be captured. We do have the young people who are gonna help us streaming live. We're gonna share those access to the website and stuff. So you guys are gonna take over now. I'm gonna hopefully relax and sleep. So then you can share with everybody else, tag people so they know, as Mr. Prank just say, take them along with us. But that's the only way they will see, okay, you guys are doing something else. And they can see, okay, you're working so hard, but also you're enjoying, you're discovering other part of the world. And your impact, you might not even see it now, but those people, we appreciate every second you spend with them. And you will see when you get there. You will see. I'm sorry, Bree, you wanted to say something?
No, I was just saying that I don't know if we have business cards or something, because yesterday at the hospital, I was discussing the trip, and, you know, nurses don't know me. They didn't want my phone number for me to give them the QHSC website or anything. So they really were interested in it. So I wanted to like give them something, but instead I just wrote it on a piece of paper.
We'll fix that.
Okay. Thank
Tuesday
you.
after the test, we'll fix that.
Okay. Yeah, they were really interested.
Yes, and in fact, that helps. I think Mr. Siakabe was showing me how to use my cards digitally. So then if I have that, I could have shared with you, and then they can scan, barcode scan, and then they can have my information right then and there. So we're gonna get there. Parang Karane is gonna help us with that, right, Parang? Yeah. All those new people knows all this digital world, and I said, I'm gonna let them do their work. Now we have all these people who wants to go, so definitely. And thank you for sharing that, Bree, because that's what we want, word of mouth. Just spread it out there. People need to see what you are doing, and you guys are doing a great job by taking the time, taking care of somebody else who is more than yourself. So that's great.
We're gonna get a video from Maricela, and it's gonna say, we expect for QHSC to be a household name in the next 2 years.
And we're gonna ask her to
Listen,
say
don't
it
you
in
need
Spanish.
being extra because you know how to do it. I get a little bit deterred from school, but you know, it'll get done.
No, that's okay. No, we're gonna appreciate, as I said, we need to start using those, like month of June, we need to be everywhere. And so I'm gonna need your help, guys. We need to be everywhere. All these little short videos, less than a minute to a minute and a half. That's it. We need just to flood everywhere else and share. And if somebody posts something, just share with everybody else. That will help to put our weight out there. And the more people help us, sometimes if they help the organization or they help the medical mission, so that money is given, it's going to be logistically distributed to help with some of it. Maybe might pay transportation in Tanzania. So that month, if we have the money, then usually we deduct from whatever you need to give out. So all those things will be possible if we get people who can support the medical mission. Yeah.
Bree, we have homework over our break.
Yes.
Yes, I know, a ton.
I know, when you're getting Q6. Whew. It'll be good. It'll be good. You have the energy because that time will be like counting down for the medical mission. You'll be like, nothing is going to deter me now. Let me get this homework. Let me get the test. I need to go. I need to go. Okay, guys, if you don't have any questions, I don't want to keep you. Thank you very much for coming, and it has been a blessing to see all of you. And thank you for all your questions. Please keep them coming. And I'm going to try and get those answers for what you guys have asked. If I get them soon enough, I'm going to text that gentleman right now from Tanzania, from the hotel, to get those information, and from the agency for the safari to get that information if we can update you. So if I update before I send the video, then I'm going to add a screen or something for the video, and you will get it information in there. So please send me that information, what I need for invitation letter, and then we keep going. Okay, so I'm going to get the gallery picture and everybody comes to the screen so we can have that picture and start showing we're there. So Mr. Jones, Miss Victoria
That's
Jones.
funny.
Yes.
Sorry, one more question. So aside from going to the hospitals and schools, what should we pack ideally? Should it be like something that's long to cover our skin, or should it be shorts if it's hot?
Usually I would say something long and cover your skin, because it's gonna be hot. It's the direct heat from equator. So
Okay.
like you can have something to get to the water. I mean, like you underneath if you need to get in the water, like when we go to the second day of safari, then yeah, but most of the time, long sleeve, because if you go to inside the hiking and stuff, there's little bugs and stuff. You don't want to expose your skin because they're gonna bite you. Yeah. But as I said, we're gonna go through the list definitely at the end of the June, because by then your activity and stuff, it's gonna be itemized. We're gonna have that list out. Yeah. Lady Santa, hi. Okay, guys, it was nice meeting you guys, and thank you very much for everything. Hi, Miss Christine. Bye, Mr. Jones.
You guys have a great and wonderful weekend, and try to enjoy it.
We will. We try. Thank you very much.
All right.
Yes.
Bye.
Bye, guys. Yeah.
Welcome. Bye.
Bye.
Bye.